Welcome to another topic of discussion whereby we have with us the mandible, which is another facial bone. And the facts about mandible is that it's the lower jaw bone and is the largest, strongest facial bone. It articulates through its condyle via an articular disc with the temporal bones at the temporomandibular joint. The primary function of mandible is mastication or chewing by holding lower teeth and providing attachment areas of muscle of mastication. This large arc-shaped bone is the only movable skull bone other than the auditory ossicles, which are the small bones of the ear. We'll get to learn about them as we will be moving to another phase of our discussion. So without much ado, let's get to the skeleton of the skull and find the real location of mandible. Definitely the mandible is located at this area, which we find out that there are the lower dentition of this bone, and as well we have other structures within the mandible, including the alveolar process of mandible, where the root of the tooth originates, just as we did find it at the maxilla. We as well have the mental foramen within the mandible. Remember this, the architecture of the skull from anterior view. This is the lateral view, and there with us we have the mandibles. And remember we did talk about the temporomandibular joint between the temporal and the mandible, and the joint itself is right there. The disarticulated skull, we have the mandible at this location, and as well from the lateral view we have the bony mandible at this location. For at least detailed structure of the architecture of the skull, the bony mandible is right with us here, and for the few structures which are highlighted here, including the part labeled 31 is the condylar process of mandible, then we have 32 is the coronoid process of mandible, 14 is the mandible bone itself, then 15 is the mental foramen, 16 is the mental protuberance. So for this part, I know you can ask, this is the mandibular notch, then we have the angle of mandible, but let's get to the real facts so that we can discuss about them. The alveolar process is the ridge-like arc containing the alveoli, which is the socket for the mandibular lower teeth. The body corpus or horizontal ramus is thick bony part of mandible that anchors the teeth. The mental foramen is the foramen located on the lateral corpus surface near mid-corpus below premolar region, and this foramen transmits the mental vessels and nerve. These bones of the skull, or the mandible itself, to be specific, for other structures of which we've been able to mention, including this part, which is the body of the mandible, the mental foramen, and as well alveolar process. Let's find it, the part labeled 18. This exactly, or this area is the this is the body of mandible, but the alveolar process, it's definitely at where the roots of the teeth originates from. The part labeled 21 is the oblique line, but let's just get to learn from single structure. So from 13 is the condylar process, then 14 is the mandibular notch, 15 is the ramus of mandible, 16 is the masseteric tuberosity. Then we have the part labeled 17 from this other structure, which is the angle of mandible. Then we as well have other part, which is 18, is the body itself. Then another part, including the 19, is the coronoid process. 20, as mentioned, is the alveolar process, including the teeth, which are right there. Then the part labeled 21 is the oblique line, 22, mental foramen, 23 is the mental protuberance, and finally the part labeled 24 is the head of mandible. So those are the structures of which we'll be getting to learn about them as we'll be moving ahead. So oblique line is a weak eminence that passes from the root of the ramus to the area at the near the mental foramen. Mylohyoid line obliquely crosses the medial surface of the corpus, beginning near the alveolar margin at the last molar position and diminishing as it runs anteroinferiorly and it marks the attachment of mylohyoid muscle, which elevate the tongue and the hyoid bone. So those structures of which have been able to mention. So this is the real architecture or the real bone. Let me just say so, because actually this is the real bone of the mandible. We have the masseteric fossa, and we'll still get to learn about them. Masseteric tuberosity, oblique line of which have been able to describe. Mental protuberance, mental foramen. We have the ramus, ascending ramus, mandibular notch, which is located right here. Then we have the coronoid process. This is the lateral view of the mandible. From posterior, we can at least find other structures, including the digastric fossa, located at this level, mental spines, sublingual fossa, we have some mandibular fossa, mylohyoid line, pterygoid tuberosities, mylohyoid groove, lingular, and finally the condylar neck. Extramolar sulcus is the gutter between the roof of the anterior edge of the ramus and the lateral alveolar margin of the last molar. This area gives rise to the buccinator muscle of the cheek. The submandibular fossa is the hollow beneath the alveolar region, superior to the mylohyoid line in the premolar region. In submandibular gland, which is salivary gland, rests in this fossa. Mandibular torus is the variably developed thickening of the alveolar margin just lingual to the cheek teeth. So we have the corpus right there, extramolar sulcus. This is the level of that apart. Then endocoronoid ridge is the other level. Then mandibular condyle is this area. So this is mandible from superior view, as you can able to check, as you can see the arrangement of the teeth. The mandibular symphysis technically refers only the midline surface of unfused right and left mandibular half of individual less than 1 year of age, and it's often used as a general term referring to the anterior region of the mandible between the canines. So that's all about mandibular symphysis, and it was hard for us to find at the mature skeleton of the mandible. The mental spines lie near inferior margins of the inner surface of the anterior corpus. They are variable prominence and anchor the glynoglossal and the glenohyoid muscle, which are the muscles of the tongue. So genial tubercle mental spine is donated by the position of 25. Other structures include the part labeled 15 is the mandibular notch. Then we have the part labeled 24, which is the head of mandible, 19 is the coronoid process, as well 20 is the alveolar process, including the teeth, as we've been able to mention, then 26 the mandibular foramen, entrance of mandibular canal. These are all both superior view. Mental protuberance is the triangular eminence or bony chin at the base of the corpus in the anterior of the symphyseal region. The ramus, this is the vertical part of the mandible rising above the level of the teeth and articulates with the cranial base. Mandibular condyles is the large round articular prominence of the posterior superior corner of the ramus. It articulates with the mandibular fossa and articular tubercle of the temporal bone at the temporomandibular joint. So that is the main part where it articulates with the temporal bones. So for the mental protuberance, it's definitely around there. Then you have at least other part of which you've been able to discuss, this ramus of the mandible, which is definitely located at that point. So gastric fossa are the pair of roughened depressions on the posterior inferior aspect of the corpus adjacent to the midline. The first posterior inferior and are attachment site for the digastric muscle, which are the depressors of the mandibles. Coronoid process is a thin triangular with anterior border being thickened and convex, and its posterior edge is concave and thinner. Both medial and lateral surface of this process receives the insertion of the temporalis muscle. So that's the part which we were able to identify the coronoid process, where they receive those muscles. So this is the same bone. We have the mandibular foramen, condylar neck, lingula, mylohyoid groove, pterygoid tuberosities, mylohyoid line, submandibular fossa, the submandibular gland rests, then sublingual fossa, the gastric fossa and mental spines right there. The condylar neck is the area anterior-inferior to the condyle, ahead of the lateral pterygoid muscle, attaches to the anteromedial surface of the neck just below the articular surface of the condyle. In the pterygoid fovea, this muscle acts to depress and stabilize the mandibular condyle during chewing. So the mandibular neck is at least a location where this muscle definitely originates. The mandibular notch, which is in Sura, is the notch between the condyle and the coronoid process. So we definitely have those structures, and I think we've been able to master them because it's all I've been repeating time to time. So the ramus, mandibular notch, actually coronoid process, masseteric tuberosity, masseteric fossa, oblique line, mental foramen, and definitely finally the mental protuberance at the anterior aspect. The angle or guinal angle is the area where each ramus, singular form, meets the body, and the masseter muscle attachment is centered on the lateral surface of the ramus along this angle. The masseteric tuberosity is the raised roughened area at the lateral edge of the guinal angle at which masseteric or masseter muscle attaches to. For the masseteric fossa is variable expressed hollowing on the lateral surface of the guinal angle, and then endochronoid ridge or buttress is the vertical ridge extending inferiorly from the coronoid tip on the inner medial surface of the ramus. Mandibular foramen is the beginning of the mandibular canal which enters the bone obliquely. It's centered in the medial surface of the ramus. The inferior alveolar vessel and inferior alveolar nerve enter the bone through this opening running through the mandible via the mandibular canal and are distributed at the mandibular teeth. Another point of discussion is lingula. These are sharp variable shape projection at the edge of the mandibular foramen to the attachment area for sphenomandibular ligament. So I think it was such a typing error, which is just but a 4 sphenomandibular ligament. So that's the part which is known as the lingula. Mylohyoid groove or sulcus crosses the medial surface of the ramus, running anterior-inferiorly from the edge of mandibular foramen, and it lodges the mylohyoid vessels and nerve. Pterygoid tuberosity interrupt the medial angle posterior-inferior to the mylohyoid groove, and they mark the insertion of the medial pterygoid muscle, which is an innervator of the mandible.